welcome to the Cardinal News of Virginia, a podcast from Cardinal News. We're a nonprofit independent newsroom. We serve Southwest and Southside Virginia. I'm Dutchie Jessee. The Cardinal podcast is sponsored by the Virginia Rural Health Association, improving the lives of rural Virginians through education advocacy and cooperative partnerships. Today, we are joined by Cardinal News' healthcare reporter, Emily Schabacker. Hi, Emily.
Hi, Dutchie. Thanks for having me on.
Yeah, thank you so much. And you, a healthcare reporter, there's no shortage of news, and you've covered a few things recently that we thought we'd hit on in one podcast. So it's two separate stories that you've been covering, and we'll hit on both of them. And we're going to start with an unsettling, unfortunate trend that the health district has been telling you about, the health leaders in the Allegheny Health District, if I'm correct. And that is a rise in a particular STD. Can you tell us what we're talking about here?
Yes. So Virginia and Southside Virginia and Southwest Virginia as well are seeing an increase in syphilis cases. Syphilis has been on the rise for the last 10 years or so across the whole country. Just Virginia is not immune to that. So we're also seeing an uptick in syphilis, which is a pretty serious infection. If it's left untreated, it can cause some pretty intense side effects. People develop neurological problems, organ damage, things like that. However, it is 100% curable if it's caught. So that's why public health is really, they do a lot of work to track syphilis. There's like a statewide dashboard where you can see how many early cases of syphilis, congenital syphilis, things like that are going on in the state.
Yeah, and we will dig into some of that. Let's first, though, kind of set a context. And you did that in the article that you wrote for Cardinal News recently. And it kind of honed in on something that Dr. Cynthia Morrow was telling you in terms of the difference between how unusual it was to see a certain type of syphilis about 25 years ago versus now. And she is the director of the Allegheny Health District, correct?
Yes,
Okay.
she is.
Which includes Roanoke. What did she tell you about that, Emily?
Yeah, so about 25 years ago, she worked, at a public health office in New York, the state of New York. And they had an instance where, one congenital syphilis case, which that refers to, a baby born exposed to a syphilis infection. They had one case and just all of the alarm bells went off. Local public health was on top of that, doing investigations, figuring out what went wrong. And now things have really changed. Public health has, fewer resources. We've seen an increase in congenital syphilis cases. So even though like the numbers might sound low, every time there's a case of congenital syphilis, it really is an illustration of a breakdown of healthcare. And so in 2024, there were 35 congenital syphilis cases in the state of Virginia, which is, much higher than just having one case in every alarm bell goes off. It's a very different story that we're seeing now.
Yeah, some of the increases that you report on the article are in double digits and I can't remember the time period you were looking at. So can you spell a little bit more out for us on that?
Yes, yes. So, from 2023 to 2024, we saw a 66% increase in congenital syphilis cases. In 2024, like I said, that was a total of 35 congenital syphilis cases for the state of Virginia. In 2025, so this year to date, there have been 17 cases of congenital syphilis reported, and that is trending upwards. The expectation is that we will surpass last year's numbers of 35 cases. So
Okay,
it
so
is.
yeah,
It's
so
a
this is
scary
why
problem.
they are alarmed on the public health side. And I would like to clarify the congenital cases that you're referring to, where we know an infant has been exposed.
Yeah.
Um, is there a screening for that? That is a typical part of newborn screening?
Um, Oftentimes the baby will be born with signs and symptoms. So, babies will have like um, bone deformations.
Right.
They'll have neurological issues. Often, it's not uncommon for a baby to be stillborn or to die shortly after, arriving in the world, which is just really sad and a very horrific situation. So the outcomes for the babies, they're very severe. And so yeah, oftentimes, I think that when a baby is born with some problems, there's screening, there are
Yes.
processes in place to
Right.
figure out what the baby is suffering from.
So one of the quotes from your article has your public health leaders like Dr. Morrow citing this as an abject failure of the public health system, which is pretty dramatic language. Why is that the case? Why can they say directly it's a failure of the public health system?
Well, when a mother goes through her entire pregnancy, and then, still gives birth to a baby who has been exposed to syphilis, there were many missed opportunities to do screening, to develop a relationship with that person, with the mother. Um, and so there's just a lot of gaps in care that are happening. Usually, mothers are screened at their first prenatal appointment, and they're also, they're screened and tested, treated if it's needed. Um, then there is an assessment of their risk. So they talk about their living situation. They talk about their, if they have a substance use issue. And they do an assessment on if that person is at risk for coming in contact with syphilis again, or, throughout their pregnancy. If somebody is assessed to be at risk, they will be tested again at their next prenatal appointment. Um, However, in Virginia, we're seeing a decline of prenatal services. We're seeing a decline of OBGYNs, a decline of hospitals in general. So when we see a woman give birth to a baby who's been exposed to syphilis, it demonstrates that they're not getting prenatal care. They're not getting adequate prenatal care.
Okay.
And the American College of Obstetrics and Gynecology has updated their recommendation that women, no matter their risk assessment level, should be tested for syphilis at every prenatal appointment, because it's exploding. The
Yeah.
infection rate exploding.
So, and we'll get to that testing and those recommendations a little bit down the road here. But is the audience or the I shouldn't say audience, patients or people affected? Are the people affected by this? Is that changing from what it used to be, where we used to see cases and now it's changing? Can you tell us about that?
Yes, so that is another reason why this issue has piqued the interest of public health. The syphilis cases used to be largely in the communities of men who have sex with men, so gay and bisexual men. Um, and now that's changing. So we're seeing more syphilis and infections
Mm-hmm.
in women of reproductive age. So it's moving into a broader demographic. Um, and it's just not in our practice to test women as often as we may have tested men in the past. And so that's part of the reason why so many syphilis cases are falling through the cracks.
Yeah. We not to get too medical or detailed, but I think some people would probably want to know who maybe aren't familiar when you're talking about this infection. Is it simply a matter, usually, and not the congenital cases, but the disease itself as it transmits? Is it as simple as unprotected sex? Is that one of the cases there where it's a matter of that? So are they looking at maybe awareness, education, or stigma, or just, again, like I said, awareness? Some people might not realize that this is a serious infection, as you said, and you might then want to talk to us about Mr. Cook's job, I think his name is,
Mhm.
um, because he has an interesting job tracking it and some interesting thoughts on that.
Yes, yes. So Jeff Crook is the disease intervention specialist for the Roanoke Allegheny Health District. And his job is to find folks who have likely come in contact with a syphilis infection and go chat with them and, coax them into treatment. It's a delicate
Yeah.
conversation. And a large part of his job is around education. He often finds himself explaining to folks just how severe it is to have a syphilis infection. And of course, the public health department does a lot of work around increasing awareness of these more severe sexually transmitted infections, and advocates for protected and safe sex. And part of Jeff's job is to approach these folks with a lot of empathy. I think that like one of the biggest barriers to doing his job is just the stigma around STIs and especially these more severe ones. And it comes hand in hand with a lot of other factors too,
Right.
like negative feelings about public health that have really exploded since the COVID-19 pandemic. Um, and, I think that at times he's met with some very hostile attitudes.
Yeah. So when you say negative feelings about public health, you're speaking about hostility toward public health workers, correct? Like
Yes.
mistrust and things that have happened in the culture
Mhm,
that started really, really peaking during COVID and then seem to be, residual.
mhm, mhm. Yes, those feelings have not gone away completely. They're I think that people were not very aware necessarily of what public health did prior to the pandemic. Um, and then, with the pandemic, public health had to step up in a big way and do a lot of contact tracing, a lot of work. They're
Right.
asking, people to do things that they didn't really want to do. And so, anyway, those feelings have persisted in the culture. And it's made it much more difficult to get in touch with folks who may have had a syphilis infection
Yeah.
because they,
It,
they don't want to talk to public health.
yeah. And I'll ask my next question. If you feel like you need to mute and take a sip of water, you're welcome to. This happens when we converse, when we're talking. But one of the things about Mr. Crook's position, and that you pointed out in your article, and that I think is such an interesting aspect, is also complacency. Not realizing we've touched on it a couple times already, but I think it's worth emphasizing. People have a misconception, perhaps, about the severity of this, and it
Mhm.
strikes me that that is got to be related to the fact that STDs in general have long been a punchline in pop culture, on from everything from, sketch comedy shows to other things. So there might be a general, disregard for it, dismissiveness, flippancy over it. And he's fighting that now, and they're seeing that, so I I imagine they got in touch with you and other media to let people know, hey, this can be quite serious. This is not a laughing matter.
Yeah, yeah. So, he shared with me that oftentimes when he goes and, talks to people, a lot of times he gets the response that, oh, I thought syphilis wasn't around anymore. Like, I thought that was an STI from, a long, long time ago. Um, and it was really interesting too, talking to Jeff. He mentioned that like the younger generations who don't remember when HIV was a serious serious problem. We didn't know very much about it. Around that same time we also saw an uptick in syphilis cases,
Mhm.
and it was just a terrifying time. and it was heartbreaking. A lot of people died, and for many generations, that was fresh in the mind. A lot of people were aware of that, and they were practicing safe sex. They it was just very forefront in the memory. But now with younger generations, it's not so much, it seems like a thing of the past. Like it's
Yeah.
not really at front of mind. And especially since we've moved so far from that period of time,
Mhm.
and we're not seeing so many cases, we're not seeing as many people pass away from those things. Uh, there's definitely a complacency
Yeah.
around how severe these STIs can be. And, if syphilis is left untreated, it can cause a lot of uh, issues, and it becomes harder and harder to treat.
Yeah.
There we do after about a year of having a syphilis infection, it does become, they call it a late stage syphilis infection. And oftentimes you don't have any outward symptoms, and it's less contagious. It's not like totally safe, it's just a little bit less contagious. And so because the caseloads are so high, those late stage syphilis cases are not as important to track. Um, Public health really has, they have limited resources. They need to focus on getting those early cases sorted out and get people into care. But that doesn't mean those late stage cases aren't important. It's really important to still be testing and, looking for those people. So,
Yeah, and before we leave this topic, it also strikes me as, you know, when you described how it's not top of mind anymore, it's not in the forefront of our culture. Well, we've also just been through a global pandemic that was all about upper respiratory and then long COVID. And so, I think there's only so much room in our brains, and so COVID kind of took over everything. And so I imagine that is part of that cultural mindset as well. Before we hit this next topic, I do want to let people know you mentioned earlier about the recommendation changing for syphilis testing, and
mhm.
that that's now recommended. Is that recommended in all pregnancies early on? And if so, does insurance cover that? What should people know about that? Because insurance is going to be a big part of many people's decision making.
Mhm. Um, you know, so right now, the CDC recommends that pregnant women be tested at their first appointment. And I believe that, like, through a CDC recommendation, depending on where that is in their schedule, it will be covered by insurance. The American College of Gynecology and Obstetrics has updated that recommendation. They updated it in 2024 in response to the increasing number of syphilis infections across the country. They recommend, regardless of risk, that women be screened for syphilis at every uh, prenatal appointment. Um, for that in particular, I am not sure how insurance would approach that, or Medicaid for that matter, because a lot of women are covered, pregnant women are covered by Medicaid. Um, but for um, the treatment and testing, especially if there is concern that, anyone, whoever you are, pregnant, not pregnant, um, has come in contact with a syphilis infection, testing and treatment can be accessed for free at federally qualified health centers or community healthcare centers. Um, and, a lot of these places also offer like a sliding scale. So if you maybe don't qualify for free care, they can get it for you at a very reduced price.
Okay.
So there are options.
Yeah.
Especially for syphilis testing, they want this to be a very low barrier sort of situation for folks. So.
Yeah. Thank you. And anyone who, is looking for more information on this, of course, the article has been published. So go to cardinalnews.org. We don't have paywalls, so you can find whatever you're looking for right there. So thank you, Emily, for that. Now, on a separate topic that you have covered recently as our healthcare reporter, You recently let us know that we now are looking at some residential treatment facilities for pregnant moms and their children, and pregnant moms who are dealing with substance use disorder or have addiction disorder. So tell us a little bit about that. You have been covering some challenges among pregnant women in recent months with Cardinal News with an initiative that you've been doing. So this is part of that coverage. Give us an update, if you will.
Yeah, so when I started reporting on this about a year ago, there was maybe one option for women who were pregnant, women who had other children and were struggling with a substance use disorder,
Mhm.
and needed like a residential treatment option. There was, one in Roanoke, and they could take a handful of moms, and usually couldn't take them if they had more than, one or two children. Um, and that was, when I reported on that, it was a big issue, a big challenge, in Southwest Virginia. But now, with opioid abatement funding, there have been two organizations that have applied for funding and received some grant money. So, Ballad Health will be opening a residential treatment facility where pregnant women or women who are already mothers can go get the substance use treatment that they need. And it's also like a very homey, cozy environment, and their children can come with them. And the program also, supports things like childcare. They help parents get their kiddos enrolled in public school. Parents also will have access to parenting classes and things like that.
So,
So
Emily,
ballots,
is that what you describe in your article as the wraparound services? Is that what that refers to? Yeah, and that's integral to this, isn't it?
Yeah, it's really nice to see. It's kind of exciting because I've been following this topic
Mhm.
for so long, but Ballad Health did this really interesting thing with their most recent community health needs assessment in Southwest Virginia, where they took a poll of folks' adverse childhood experiences, which are, there are certain categories where if these things happen to you, you're more likely to develop a substance use disorder or more likely to have, it affects life expectancy. There's a number of things that it will affect if you have an ACEs score that is above 4. So these adverse childhood experiences are things like if you had a parent commit suicide, if there was substance use in your home, um, if you were in foster care, things like that, if you had a parent that had an alcohol problem. Um, and they found that like a very large percentage of folks in Southwest Virginia had an ACEs score of more than 4. So to them, that showed, generational trauma, that showed some problems with um, difficult housing, just the lifelong difficulties that are unfortunately passed down from generation to generation. So that's why they took a look at uh, their community health needs assessment and said we really need to do something to address this generational cycle. And these so with the residential treatment facilities, the hope is that that will help break those generational trauma. They'll help break that cycle by getting kids into school, by getting parents some, support in parenting their children. Women can have safe housing while they kind of like get their life back together, and they can start looking for work and things like that.
Where are these going to be? What's the plan? These new centers. How many are we talking about? Do we know?
So there will be one in Norton,
Mhm.
um, and that will be in the old, I can't remember the name of the hospital, Mountain View Regional Hospital.
And that's down
Um,
in the far southwestern part. Norton in Wise County. It's in one of
it's
those, sorry,
it's in Wise County.
the
No,
very
that's okay.
bottom of our state. Our audience
Yes.
at Cardinal is probably very familiar, but if you're not familiar with Virginia or our geography, um,
Mhm.
let's let's make that
Yes.
clear. So, and then where's the other one?
The other one will be in Roanoke. It is called For Truths, and they provide, it's a very critical service for women who are out of that. So there's a residential treatment facility here in Roanoke for women who are in that very early stage of um, of getting into treatment for a substance use disorder, like,
Okay.
very, very early. For Truths has a home for women who are kind of moving into that second step. So they have a little bit more independence. They'll be required to have a job and to pay a little bit of rent. It's going to kind of help them transition from that like highly, highly structured residential support to something in between. And it's still affordable housing for them. They still have access to treatment services. And so they will be expanding. They just opened their facility last year for I believe it's 8 um, residents,
Okay.
and their room for their kids too. Their expansion, they got some money from the Opioid Abatement Authority, and they will
Yeah.
be using that to expand to 12 rooms for folks
Okay.
to come stay. So.
All right. That's a great update on this coverage you've been doing recently for Cardinal News. And you can find more on both of these stories and everything Emily covers at cardinalnews.org. Emily, thank you so much for your work. And how can people email you if they want to get in touch with you?
You can reach me at emily@cardinalnews.org.
All right. Thank you so much for joining us. And want to thank everyone for listening to the Cardinal News of Virginia, sponsored by the Virginia Rural Health Association. Thank you for your sponsorship. And I also want to thank Zach Shelton from Cardinal News for technical support. Read all of our paywall-free news at cardinalnews.org. I'm Dutchie Jessee.